COVID cases soar nationally and internationally. Worldwide, there are 215,841,754 reported cases and 4,493,781 reported deaths. Florida recorded the largest single day of COVID deaths at 901. That's the biggest increase in pandemic history. America has 39,360,270 reported cases and 652,086 deaths. Medical and state officials are urging citizens to get vaccinated and wear masks. According to the CDC, teens aged 16 and 17 had the highest rate of infection. A Texas town shuts down due to COVID. Iran, a small town with a population of 1,200, had to shut down businesses and the school district. Over 100 residents tested positive in 2 weeks. When the school opened, 25% of staff and 16% of students were infected or exposed, forcing the district to close. The nearest ICU is over 100 miles away, making it dangerous for sickly residents. In Mississippi, take Mississippi's caseload. There were 3,425 newly reported COVID cases and 34 deaths yesterday. Yes, just yesterday. To date, there have been over 400,000 reported cases and 8,214 deaths. On average, the state has 3,200 reported cases and 40 deaths per week. We reported earlier this week about how this crisis is causing a massive healthcare shortage across the nation, and Mississippi isn't exempt from that problem. Joining us now is Dr. Justin Turner, the CEO of Turner Care. Dr. Turner also serves as the COVID-19 task force for Mississippi State Medical Association and the city of Jackson. Welcome to Roland Martin Unfiltered, Dr. Turner.
Glad to be here, Doc.
Wonderful to have you. Now, the numbers that I just recited to me are startling. Mississippi is a state that struggles in many respects. There is disproportionate levels of poverty in that state. There are already health challenges that are disproportionately present, I would argue, among the citizens of that state. How are you handling this COVID surge when you're already at a disadvantage?
Well, I have to tell you, every physician here in the state can tell you that it has been very, very difficult. Things are very, very frustrating. And a lot of healthcare professionals are quite honestly burnt out. We're doing everything we can. We felt as if when the vaccines came out, we had our biggest tool in the toolbox, and we began to see some of the numbers begin to get better. And all of a sudden, we have this emergence of the Delta variant. And it's like, every time we make 3 steps forward, we're making 5 steps backwards.
Absolutely. I can imagine how frustrating that is. I mean, what is it like, just from the perspective of a healthcare provider, to know that, in essence, you're putting your your health on the line every day? You're working long hours, trying to serve people, many of whom aren't even heeding the medical the recommendations that they've been getting. How does it feel like just to have this onslaught come at a time when many of us may have thought a few months ago we might be going downhill by now?
Yeah, so even before COVID, like you said, Mississippi already has just a plethora of different health disparities that we're already dealing with. We had COVID on top of it, and it's really been, just problems on top of problems. So here we are now, maybe working, I used to work 60 to 70 hours a week. Now it's like 80 to 100 hours a week. I would normally just see maybe 20 patients a day in the clinic, and now sometimes it's 30 to 35. In the hospital, it's even worse. Just last week, University of Mississippi Medical Center just basically created space in a parking garage just so we can be able to have patients. As you mentioned, we're having issues with shortage of resources. So we have outside help that's coming in just to provide nurses and medical personnel just to be able to help us out, because we're literally treating patients in parking garages because the hospitals are so full. We do have some people in Mississippi that get it and that understand, But unfortunately, there's too many people who are still downplaying the severity of this virus. They are still spreading misinformation after misinformation. That part is very frustrating because as a healthcare worker on the front line, yes, I still have to go home to a wife of mine who has asthma. I have an 11-year-old who has asthma who actually is on quarantine right now because she was possibly exposed yesterday. So this definitely hits home. We basically only have about 37% of the population that's been vaccinated. When you have states like Vermont that is in the mid-60s, it's disappointing because it's like Mississippi. Why are we okay with continuing to be the last, especially when we have about 8,000 people who have died from something where we know that the vaccine definitely helps, reduces the risk of severe hospitalizations. It reduces the risk of death. Over 95% of people in our hospital who have COVID are unvaccinated. Over 90% of the deaths are people who are unvaccinated. So at this point, we don't know what else to do because it seems like everything that's being done, unfortunately, is falling on deaf ears.
It's very frustrating to me, and I'm sure it must be this times a million in terms of the level of frustration for you, is the degree to which this issue has been politicized. This is a public health issue. You are literally putting your life on the line, putting your wife and your child's health on the line to be able to serve people, while at the same time you are fighting against politicians around the country and in your specific state that are making your job that much easier because they're either trying to not have people wear masks or to discourage people from getting the vaccine. I mean, how are you able to fight back against a political dynamic like that that's fighting against you every step of the way?
Yeah, I don't know if Texas, Mississippi, and Florida, leadership just get on the phone and figure out how we can make our state more miserable. I don't know. But, as physicians, we signed the oath to do no harm. I went to Meharry where our motto is worship of God through service to mankind. And that's all we're about. The virus does not care what your political affiliation is. It's not Democratic. It's not Republican. It is here and it's here to destroy and it's ravaging our communities. This is a Republican-led state. And unfortunately, it appears that a lot of people are more married to politics than they are to purpose. Because this nation that we talk about, as far as America being, land of the free and home of the brave, we talk about freedom. The true freedom is the freedom to have life and to have that more abundantly. People are talking about this survival rate of 98%, but here in Mississippi, our mortality rate is 2.2%. So you mentioned about the 3,000 plus new cases. So if you look at 2.2% of that, you're looking at basically, almost about 40 people that are going to die out of that within the next few weeks. I just had a patient just 2 days ago who's 51 years old. His mom just died last week. Now, I sat down with he and his mom approximately 2 months ago, went through the science, shared this information with them because they were on the fence. They were hesitant. They was hearing that the vaccine changed the DNA. They was hearing, well, what's the point of getting the vaccination if you can still get COVID? So after education, they agreed. Honestly, like the majority of our patients that I've had a conversation with over the last couple of months. But I got a call saying that they both was in the hospital and they both were suffering. They both were on a ventilator. The mom did not make it. Now, unfortunately, he did. He came home and he was on home oxygen. And guess what he said? He said, Doc, I'm ready to come in and get the vaccine now. And I said, well, honestly, just tell me, what made you not get it when you told me you would? Doc, I just don't know. So we can probably get his lung capacity back, but we won't be able to get his mom back. And it's just, it's really, really breaks our heart because we probably have about 4,000 patients here at Turner Care. And since the vaccine has come out, that's the only patient that has died.
Oh, my goodness. That is a heartbreaking lesson for anybody to learn the hard way, especially when they didn't have to. If you had to give one last piece of advice to individuals right now who are maybe like that gentleman and his mother, and for some reason, they're putting off getting the vaccine. They're lackadaisical about wearing their mask. They don't take it seriously, or they think that some of these conspiracy theories about the vaccine is actually true. What would you tell them about what they need to do now to save their life and the life of the individuals that they love?
Well, I would tell them that I'm a medical doctor. And I wouldn't expect them to come to me and ask them how to fix their refrigerator if it breaks down. I wouldn't expect them to come to me and ask me how to fix their motor or their car if it's not working. But as far as the science, I want you all to trust the same people that you trusted when your kids had a snotty nose, the same people you trusted when you had chest pain and you was concerned about a heart attack, the same people who actually encouraged you to make sure your child got the vaccination for the mumps, the measles, the rubella, that you all got as children. We're the same scientists. We're not here to discourage you, but we're also not here to disguise you. We never told you that the vaccine was 100%. What we told you is that the vaccine reduces the severity of disease and reduces the risk of you dying from it. We told you about 95%. So that means that there's some people who still going to have some problems. But the virus is always going to be more dangerous than the actual vaccine. Always going to be. And last thing, think about seatbelts. Seatbelts reduce the risk of you dying. You do not stop wearing seatbelts just because you heard that somebody died in a car accident with their seatbelt on.
No wiser words could have been said. I want to thank you so much, Dr. Turner, for joining us. And I certainly hope everyone who's watching us today takes heed of your warning and your advice. Thanks for joining us.
Thank you so much for having me.
Folks, back to that Roland Martin Unfiltered video in just one moment. Seek.com. We're partnering with them, of course. We appreciate their support right here on Roland Martin Unfiltered. Check out a couple of their products that you can take advantage of. And you're watching us on Seek.
What's going on? This Quavo Huncho, but right now you in the Huncho's world. Please let the music play.
Enjoy the Seek.com video by using one of their virtual reality headsets. All you do is just pop your phone right here into the VR headset and enjoy the content. You can also take advantage of their 360-degree headphones. These headphones here come in a couple of colors, black and gold, but then also all gold. And so you can check these out. If you want to use our promo code to get a discount, it's RMVIP21, RMVIP21. Then, of course, a portion of the proceeds comes back to Roland Martin Unfiltered, which allows for us to fund the show. And so this is a black-owned company, and we certainly believe in supporting black-owned companies. Mary Spiel is the founder. And so, again, go to Seek.com and use the promo code RMVIP21.